Well, hello YouTube. This is the first time um, uh, I'm creating a live stream because I wanted to be a part of a community um, that can help me in learning more about the developmental milestones of premature child. I'm 34 and I'm a father of a premature son who was born premature by 8 weeks. He was born at 32 weeks of gestational age. For a particular reason which you can see in the screen, it's PPROM, which is preterm premature rupture of membranes. um, yeah, he was born at 32 weeks of gestational age. He essentially he was in the NICU for 17 days, but the great part, and by the grace of God, he did not have to face any kind of other difficulties, for example, breathing difficulty or any other sort of difficulty. He had an examination of retinopathy of prematurity. They used to, almost on a daily basis for first at least 4 or 5 days. He had regular blood test for any sort of infection. Luckily, which was not there, but he was on antibiotics through IV. He was not he was unable to take feed for first, I think, 3 days. Then they started giving the feed through the nasal pathways, and then also oral pathways, and all of those feedings were force fed. So the fact of the matter is, even if I consider that not to be a great ordeal considering what other parents go through, but it's been terrible for my kid. Like, it he was there 17 days. We really couldn't get close to him. um, for the fear of infection, I don't know what's the irrationality or rational behind the fear, because both the doctors gave us different perspectives. So our pediatrician told us, hey, do not go very close to your son because you might get him infected. You're coming from the outside. The visiting hours were really narrow, and the doctors who were at the rounds at the time, if we asked them questions, that they tend to get really pissed off. And I never got complete answers, because the way in India patients are treated by the doctors is basically they're treated as somebody who has no understanding of any medical term whatsoever. I I kind of found that kind of patronizing, because you have to work with the patient, and that's why I found a sea difference in attitudes with the doctor who actually has worked in other countries like UK. So the last doctor that I visited um, for my own troubles was he actually worked in UK for 6 years, and then he came here for his own I don't know what I mean, for his own um, I think he came back to his motherland only. That's it, maybe the reason. But he was there for 6 years in UK. He practiced. He was a colorectal surgeon, and I totally saw the stark difference between the behavior. He was very nice, cordial, discussed at length, gave me all the options, and considered me to be basically treated me as an educated person, right? Treated me as a person who can take his own decisions based on the medical facts, based on the, and he explained whatever I asked him. Like, he took the time. That was not the case. I was at a quite, to be very honest, very costly hospital in Kolkata, and well, there are two kinds of behavior that I've seen. One was, who did the operation of my wife was a very senior doctor, and he suggested go and hold your kid, like the kangaroo mother care, early on. And our pediatrician said, no, we only allow you when he gets out of the NSU. We have established the feed. So I don't know how much that has impacted his neurological development for the first 17 days. So if I search, like, if I search for it, so if I typed out like how long, how long. What I'm actually searching for is that does a kangaroo mother care or delaying of the kangaroo mother care has long-term impacts on a child's development? Because that was one of the odd things that I saw. Um, so I'm trying to find out if that particular practice is accurate or not. Yes, it's not. So what I'm looking for here is delays the initiation. It says delayed initiation in duration of kangaroo mother care can have negative long-term impact on the child development, especially for preterm and low birth weight infants. Yeah, my son was low birth weight. He was like 1.7 kg and he lost a bunch of weight at like 150 gram. He was like 1.55 kg. Then I started alerting the doctor. So as you can understand, it's not the best level of care that I received, but the money I paid was top bucks. So I was not very happy with that. So research indicates that early and prolonged KMC is linked to better neurological development outcomes, including cognitive, motor, and behavioral developments. Delay in KMC can result in an increased risk of neurodevelopmental disabilities, sensory deficits, long-term health problems, and for infants who survives beyond the neonatal period. So a large cohort study from the international journals of contemporary pediatrics in India demonstrated that infant who receives more hours of KMC per day has significantly greater weight gain, length, and head circumference growth compared to those who received less. And also, this is, I don't know, this could be another problem I find. Yeah, another problem that I find with this sort of AI chatbots is they hallucinate way too much. Impact of duration of kangaroo mother care. That's not what I'm asking. Yeah, like she gave KMC for 2 days and then my son was transferred to the bed, uh, general bed. So he was ready to go. Like after 2 days of KMC, so he was kept in the NICU for 17 days. Within that, there was a couple of days KMC, so 15 days without any KMC or touch of the mother, which was essentially what we are talking about. Now the WHO, what this WHO is saying? WHO is saying pediatric association emphasized that KMC reduces risk of association with delays and absent skin to skin care such as chronic illness, neurodevelopment disorders, lasting childhood and beyond. So what kind of my question would be, does it yeah, so talking about my son, he well, talking about my son, he started crawling. So proper 4-point crawling. I'm not talking about commando crawling or other sorts, right? We saw commando crawling around his 6 months of corrected age. So the concept of corrected age is like this: if your son is born at 32 weeks and he was supposed to be born at 40 weeks. The general question is, So he was born at 32 weeks. He was supposed to be born at 40 weeks. That general question is how his milestone will be delayed. And only reliable answers that we have found that we consider, or we well, the better way to put it, that we calculate his milestone, or we measure his milestone based on what his corrected age is. So he was born 2 months early. So let's say he is 9 months at this point of time, right? We will consider, if he is 9 months at this point, we will consider his corrected age to be 7 months, and then we consider his progress, or we compare his progress with another child who was born at 40 weeks at the age of 7 months. So if my son exhibits the same sort of activities and same sort of behavior or neurological development, well, we are at the green, yeah, we are at the right side of it. But if he lacks some of the coordinations, we are at the wrong side. And I saw one of the videos, one of the famous pediatrician in West Bengal. He was saying that the kid, or the children or the babies who is born at 42 weeks has the lowest chance of any kind of congenital or otherwise developmental disorders like autism, dyslexia, and so on and so forth. So all of this has definitely weighed up on me, right? He has his nasal bridge was a bit of flat, which he gets from his mother, and we initially thought that could be indication of something else, and we are kind of scared, does he have some sort of Down syndrome, and so on and so forth. So all those thoughts actually crossed our mind, but that didn't, by the grace of God, all of that didn't happen. We went to a pediatrician. He kind of laughed at us and said, these are irrational fears. So we understand that, but as parents, we really cannot escape these feelings. Okay, so does it delay developmental milestone? That's the question I asked. They're saying 1 year normalized control trial in Jawaharlal Medical College showed that infants can see better neurological development. We established that. That's been a repeated theme. Mental development delays in the KMC. Okay, so they're saying using standardized tests like Bailey's scale of infant development, BSID2, and then Hamilton test. Honestly, guys, I didn't know these tests exist. Found significantly fewer psychomotor or mental development delays in the KMC group. Especially muscle tone deficit and psychomotor development delays were much higher in infants who did not receive KMC. This is what get me pissed off. Like, as a doctor, you should be aware of this. You should allow the mother to hold the baby for KMC. What kind of crap is this, man? You're supposed to be up to date with this all sort of. This research was done in 2018. My son was born in 2023, so it's old news basically. They have 1 year of randomized controlled trial, and this guy was not aware of this. And when I had spoken to the I spoke to the initially when my son was born. He was in ICU. I spoke to the doctor who did the delivery. It's a very senior surgeon, and he suggested the mother should be with the kid. Should give him KMC. That was not allowed. I mean, this pisses me off, right? We cannot prevent what happened to him, like during birth, right? I don't know. You could have prevented that, but the reasons are there. I don't know. Saying that they had genital tract infection could have happened to my wife because she had urinary infection, didn't have any health concerns whatsoever, and doesn't have a history of prematurity. in a family. There could be other cervical insufficiency, all that. How do you identify those? Because I had done each and every scan and blood tests. I did the double marker test, and it came back negative. All the scans I did. We didn't get to the last scan because, yeah, he was born at 8 months. But all of this pisses me off, man. This is. You see, inclusion clarity. If the birth weight is less than 2200 gram, in an admitted in an ICU, singleton gestation, babies who were stable and taking oral feeds. I mean, what the hell? Why wasn't he allowed? Okay, what I'm gonna do is that I'm gonna ask ChatGPT the outcomes of this particular study and explain it quite easily, and then I'm gonna read it and try to understand what might have impacted. Yeah. And I have it in my local drive. Okay. Da, 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 da. Sorry, guys. AT still low birth weight babies were studied. Group 40 got kangaroo mother care, skin to skin contacts, exclusive. Okay, so coming to the point of exclusive breastfeeding, he had it. He had it for quite a long time, right? 6 months continuous. I think more than 6 months because, yeah, till his 6 months of corrected age, continued breastfeeding. All that he got all that. Muscle tone babies with KMC had muscle tone at 6 and 9 months, had healthier muscle tones. Okay. In contrast, KMC babies showed more muscle weaknesses and stiff CMC babies. Okay. Conventional method of care, which is essentially keeping the warmers wrapped and routine care. Oh man. At 1 year, more KMC babies had normal development. Only one KMC had severe delay. Da, 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 da. This is a big difference, big and significant difference. 72 years here, normal development, 45 CMC babies. Several mental delays was less than 4 babies. This is better KMC, just miss strong statistical significance. This difference was better for KMC, though it just missed strong statistical significance. Right, KMC's clearly improved outcomes at low birth weight. Babies who received KMC have fewer delays. problem that I have, and I'm gonna end my stream with this. But today, problem that I have with him right now, he can walk, he can do all the other activities, he can understand things, he can speak 1 or 2 words at times. I mean, he speak a lot of words. That's not a problem. Problem is that when he's expressing something, very rarely he speaks 2 words in continuation. He is 19 months of corrected age, and by the end of 24 months, he is supposed to speak 2 words meaningfully. So, for example, more milk, give me this, give me that, all of these things he should be able to say meaningfully. That's the point, right? And one other thing I noticed when I said to him, like, have you eaten today? He might have eaten half an hour back, and he said no. So so what I can understand is he can meaningfully spell no or meaningfully say no, but he cannot meaningfully say yes. And apart from that, I don't see any other issue in considering his memory and all that, because he quite remembers shapes, sizes, different things, birds, and other things. Different. He cannot exactly. He remember different people. He, even recall names of them. Not essentially the full name, but just the smaller names, the pet names, and all. He is getting to that age where he is just a bit of a. I mean, he's spoiled. To be very honest, he's spoiled with a lot of care because he was a preterm. So we don't really scold him much, but we keep him away from phones. But the major problem or major worry that I have, one is he has very low muscle tone, so it's quite lean, right? And another problem that I have observed is he cannot, meaningfully say 2 words. Right? He will point to things. He'll say "mama," and after some break say "terrace." That means he wants to go to the terrace, or he wants to go to the roof, he wants to go to the balcony, or he wants to go to some place. But if we are feeding me something, he'll come at us and say, point to that things and say, okay, like sweet. He will say just sweet, but he would not say give me sweet or give sweet. At least 2 words, right, back to back, meaningfully. That's what we are worried about. And to my idea, there are two factors that has particularly gone wrong throughout the whole thing. One is obviously his premature birth, and another is the KMC was not allowed initially. He was more in a conventional mother care. I don't know, anybody who has a premature kid at this point, please demand for that. If you want to have to do your own research, do it, right? I can post the research, and I've done it right now, right? It's fairly easy at this point, and these chat bots are so improved. You can straight away go and read the actual study. It's nothing is new, right? All of this has been researched. People has researched the shit out of it, right? I showed you like they at 2018 the Indian Jawaharlal Nehru Medical College has been doing this study for 1 year and at a randomized trial, right? More than I think 100 kids there. So yeah, the information is available to you. If you are having a premature kid, I know you're not a great mental state, but all the physical problems goes away. So my son had a chance of retinopathy of prematurity. He had his eye to nasal that path closed, so he used to water a lot from his eyes. And we were contemplating operations at the age of 2 or 3 years, but that didn't happen. That by physical massage, that thing got cleared up. He didn't have any kind of retinopathy of prematurity. He had a hole in his heart. They call it atrial septal deviation. I don't know what it is actually, but there was atrial septal defect. That hole has completely healed. We went to the doctor, I think 6 months back, and the results were very positive. That's not there. So all of these physical things heals, but which will not, or which might impact your child, is presence of the mother or skin to skin contacts, which actually helps neurological development. Breastfeeding, of course, does too, right? So it's always important that you go and ask your doctor why not KMC. If there is a chance of infection, can we do in a, can I like wear a robe, scrub, and then start giving mother care, right? Because the sad part is that my wife was like, after 4 days she was living with the child without her kid, and my son was in NICU. So it was a sad state of affairs, but she was willing to do, even after the operations, to come regularly to the hospital and give KMC, but she was not allowed to. But make arrangements if you have to, like make arrangements for that. It's very important, and you'll find ways, because I did not know shit about insurance or claiming insurance before I had this mishap, right? I've never seen inside of an ambulance before that, but all of the things did fall in place. Your corporate insurance helps you a lot during that time. Leverage all those benefits, and then demand information from the doctor. That's the problem in India. People will treat you like a third class citizen, and you will regret being a commoner. So you'll have to stand up for yourself. Just ask them for information. Why not kangaroo mother care? Why are we doing this? Why are we doing that? Go and read the charts of your son, who is of your son or daughter, or of a baby in NICU, right? Read the chart. Try to understand which treatment has been given, when it is given, why it is being given, right? The reason I came to know that my son's weight is falling is because I went there every day and I read the chart. I asked for it, demanded for it, and then I realized that his weight is falling. And I stood there for a couple of hours till the doctor came into round, and I asked him that, doctor, why is it falling? And I have received the worst treatment a father can receive, right? I mean, every time I have seen the doctor, he seemed really pissed off. He didn't want to speak to me. I mean, I was a nuisance at that point of time, and I didn't mind. I mean, if he would have slapped me at that point of time, I wouldn't have cared, because you need information. But the thing is, at the end of the day, it's your son, it's your daughter, it's your child. You need to have that information. Fun part happened in that hospital. When finally I was settling the bill, I saw they tried to input a dialysis fee into the whole thing, and then I had to request it to, so you will be taken advantage of. You have to be vigilant. You have to be strong and vigilant about it. Ask the doctor. When my son's weight started falling, I asked him, hey, what can you do about it? Then he said, okay, we'll give him Dexolac or Lactodex at that point of time with mother's milk, because he was drinking mother's milk at that point of time. And then his weight started improving after that. But I had to go and nudge him that, hey, this is happening. You cannot have this. I cannot have this happen, because if his weight, he's already 1.7 kg only. His estimated weight during the last scan before the delivery was 2.1 kg by the radiologist, and that came out to be 1.7 kg. and they kind of assume that your baby is going to lose a water weight and he's going to go down the scales. I said, doc, he is already 1.7 kg. You cannot do this. Right? He needs to gain weight. So yeah, all of this happened, and every situation has their different prescription, but it's very easy to do the research and find out what went wrong. Try to find out what went wrong and have a discussion with the doctor. Try to understand what he's thinking or she's thinking. Because otherwise, you'll be in a limbo. You'll see things flowing, things happening. People are racking up. You're racking up bills. I don't know what. Right? You should be aware of each and every steps that they take inside that NICU. Right? The worst part is when I used to go at 9 p.m. at night. Because I had to travel to the hospital twice or thrice a day to deliver the breast milk, because that's what the baby will eat during the day, or force fed, depending on the condition. And at the 9 p.m. I was not even allowed inside. Right? They just open the door of the NSU. They'll take the bottle and then they'll return the previous day bottle, sterilized bottle. I saw every almost, and all the beep noises were going off because of the monitors and stuff. And all the kids were crying. I don't know what happened to my kid. I don't know if he was treated properly. And one of the day I went there, his entire left hand was bandaged, right? And I learned that he kind of pulled out the IV insertions in his tiny hands, right? And the entire hand was bandaged. And nobody told me jack shit. I had to find out. They were shocked. So yeah, all of this will become very, very difficult at times, but trust yourself and trust your own judgment, and do not take any shit from anybody. Try to be inquisitive, do your research. All right, I think that's enough for today. See you tomorrow.